following program contains the opinions of its host and guests, not those of this network. The opinions expressed are for non-commercial informational purposes only. Listeners are cautioned not to rely on program content to treat or prevent disease, but are advised to consult with a licensed healthcare professional where they live for diagnosis and treatment of disease.
And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative. A lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. Well, of course, one of my favorite pearls of wisdom that Doug has dug up was just a week or so ago, where he talked about the Max Planck Institute in Germany that determined that there is no age limit for human beings. It's kind of an endless process. Well, essentially, that's what I've been saying for years, that you get rid of the bad stuff, you do the good stuff. 200 years should not be a big deal, okay, because we have a self-replicating system. You get the book Epigenetics, right? Get the book Epigenetics. In fact, contact your young TV associate to understand what I'm saying here. Get a hold of the book Dead Doctors Don't Lie and the CD, DVD, Dead Doctors Don't Lie. Get a hold of the book Epigenetics. The subtitle is The Death of the Genetic Theory of Disease Transmission, because there are no genetically transmitted diseases. Doctors are still trying to push the genome, right? We'll talk about that in a second. And then the DVD that goes along with Epigenetics is Somebody Should Go to Jail, and the CD is Public Enemy Number 1. And then Rare Earth Bin Cures goes into all the mineral deficiencies. Remember, 2/3, 90 essential nutrients, 2/3 of them, 60 are minerals. And many of them, calcium, for instance, there's 147 different diseases you can get from a calcium deficiency. So we're talking about Dead Doctors Don't Lie, Epigenetics, Rare Earth Bin Cures. And the whole idea here is, and the CDs for Rare Earth Bin Cures, you want Dead Athletes Don't Lie, What Kills Billionaires, A Stick of Butter a Day Keeps the Doctor Away. That's my newest CD, is A Stick of Butter a Day Keeps the Doctor Away. I've been saying that since 1971, and finally they came out and said, people who eat all this low-fat stuff, low-fat yogurt, low-fat non-dairy coffee creamers and so forth, everything's low-fat, they get the highest rate of Parkinson's disease. Oh, and don't forget Alzheimer's disease. Alzheimer's disease is a cholesterol deficiency driven by doctors. Alzheimer's disease is a physician-caused disease. Now, these are all the problems that have been created by the medical system, which is costing us an enormous amount of money. This is why these pre-existing conditions are just really destroying the insurance industry and leaving people hanging out there to dry. Well, you won't hang out there to dry if you contact your young TV associate, get on the 90 essential nutrients. Remember, this is 90 for life, not 90 until you feel better, not 90 if you have to give up soft drinks and French fries. No. Your priority is the 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. If you get on a diet in which you eliminate all the bad inflammatory things, no fried foods, no processed meats with nitrates and nitrites, no oils, no gluten, take the 90 essential nutrients, we can eliminate all birth defects. All birth defects are caused by nutritional deficiencies of the embryo. I'm excited about that one. Then, of course, we know that many birth defects, including cystic fibrosis and muscular dystrophy, are reversible even after the baby's born. Most of them, you can prevent them 100%, but you might require surgery or long-term care. For instance, like cerebral palsy requires long-term care, heart defects require surgery. Those kinds of things, cleft palate require surgeries and so on. They're all preventable, but cystic fibrosis and muscular dystrophy are even fixable after the baby's born with them, right? Well, what you want to do is make sure that our children are not going to be the first generation who does not live as long as their parents. So we need to make sure that everybody, young people, particular kids, boys and girls, before they're conceived, all through the pregnancy they're developed in, from the moment they're born, are getting the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, so that all of our babies will be born perfectly normal. We won't have any pre-existing conditions. Okay, type 2 diabetes is a simple deficiency of a single nutrient. Cardiomyopathy heart disease causes sudden heart death in athletes, and the need for heart transplant. I just talked to somebody today who had to have a heart transplant because they had cardiomyopathy heart disease. No. You just take the 90 essential nutrients with some extra, with this one mineral, and it goes away. It's a single. I've done 1,700 autopsies on kids under the age of 10 that have died of that one single mineral deficiency, resulting in, you got it, hypertrophic cardiomyopathy heart disease. Simple disease to prevent. If they survive the first heart attack or you get a heart attack, you can reverse it. What a concept. Then congestive heart failure is caused by deficiency of a single vitamin. Things like fibromyalgia, sarcoidosis, and lupus are all secondary to a gluten intolerance. You can't absorb the nutrients necessary to maintain and support maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes and bone itself. And then you have things like high blood pressure. What about kidney failure? You're on dialysis. I don't care if you haven't peed in 10 years, you're on dialysis for 6 days a week. Guess what? Change your diet, get on the proper supplements to promote healthy blood flow through the kidneys, and guess what? Within weeks, you'll be peeing. You haven't peed in 10 years, you'll be peeing again. And it might take you a couple of months, but you'll be off of dialysis. You don't need to have a kidney transplant most of the time. Why do doctors keep you on dialysis for years and years and years and years? Because they're using an ATM machine. They're milking you. If it's true that you can never get off of dialysis, can never get better, why is it they don't give you a kidney transplant right away? Well, they want you to come into dialysis. That's where they make the money, right? And so you have to realize, and this is where reading the books, getting the CDs and DVDs, Dead Doctors Don't Lie, Epigenetics, Rare Earths and Cures. And again, my newest CD is A Stick of Butter Day Keeps the Doctor Away, because cholesterol has nothing to do with clogged arteries. Okay? Cholesterol is an essential nutrient. Without cholesterol, you're going to get low T, ED, menopause at age 35, adrenal exhaustion, and you take statin drugs, lower your cholesterol, guess what? You're going to get Alzheimer's disease. You won't remember anything. Contact your Youngevity associate. Get Dead Doctors Don't Lie, Epigenetics, and Rare Earths and Cures. Save yourself. Save your family. We'll save America. Be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us toll-free, 888-379-2552. On the priority line, 831-685-1080. Aromatherapy oils have been prized by ancient cultures for thousands of years. Youngevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Youngevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many ancient legacy oils come directly from families in the East which have been distilling essential oils for over 100 years. Keep Ancient Legacy's tea tree oil in your medicine chest for first aid. Tea tree oil is great for soothing the itching and stinging associated with insect bites, burns, scrapes, and other skin irritations. It's also effective as an antiseptic. To learn more about aromatherapy and essential oils, contact your local Youngevity associate today. And don't forget to ask about business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine-tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local Youngevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities.
back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And we do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're going to do the longevity business as a business, and I hope you do, we need help. We're growing fast. We're on the stock market now, on the NASDAQ. I mean, we need help because we're growing so fast. Contact your longevity associate and say, hey, tell me about this business opportunity, longevity. And you're going to do that. You need to leverage your time. You need to get the tools. Ask them about what CDs you have to get. And there's 9, Dead Doctors Don't Lie is in 9 languages. You can loan them out. That way everybody in your group is telling the same story. And then don't forget, Dead Doctors Don't Lie. Don't forget, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. That's the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport to Aromatherapy. And if you've never done business before, get Wall Street for Kids, learn how to be profitable, and learn how to get all the same tax breaks that billionaires get. That's Wall Street for Kids. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a little bit about heartburn and, the drugs that people take when they have heartburn.
Do we need a flourish here?
I think so. Now, I've got a story here that I got from Fox. It's headlines, Some Heartburn Drugs Linked to Higher Risk of Death. They say, these drugs are linked, used by millions of Americans every year, and those taking them have a higher risk of death, according to a new study. And what we're talking about here is these proton pump inhibitors that reduce stomach acid, and they're also available over the counter. Other studies have shown that these PPIs have been linked to things like kidney disease, stomach infections, heart disease, pneumonia, bone fractures, and dementia. And, of course, we're talking about Prilosec, Nexium, Prevacid, and other ones that are over the counter. This all comes from the Washington University School of Medicine. And that's
where I did my big project with 20,000 autopsies.
Yep, so they're still doing good work there, it sounds like. And the study author, Dr. Zayed Al-Alei, says that PPIs are associated with all of these adverse events. That does translate to a higher risk of death and increased risk of mortality. Scientists use a large database, and they looked through the medical records of the U.S. Department of Veterans Affairs, and they compared the death rates among the users of PPIs to people who took H2 blockers, another class of stomach reduction type of drug, of course, which is not really needed. And they looked at over almost 300,000 people that had been prescribed a PPI, and almost 74,000 that were prescribed these H2 blockers, and looked at it between October of 2006 and September of 2008, tracking deaths up to 5 years, found a 25% increased risk of death in...
Holy moly!
Yeah, and they say that although that's kind of a small percentage by comparison, but that's 1 out of every 4 persons that are taking these things, and they said it accounted for an extra death for every 500 people taking PPIs. They said the results are very clear. It was startled by however they sliced it out. However they sliced it or analyzed it, was always a consistent relationship between PPI use and risk of death. And the longer people took them, the higher the risk rose. So yet another reason to not use these things. I mean, I used to have problems with that for a long time. I listened to you and started salting my food to taste, and guess what? It went away.
Yeah, exactly right. There is no such thing as acid reflux. It really should be called lack of acid reflux. People did not start getting reflux until doctors told them to restrict salt. Salt is the raw materials for the chief cells in your stomach to make stomach acid. Stomach acid gets your pH down to below 2, like 1.2, 1.5. It keeps your stomach sterile. Yeast and bacteria cannot grow in there. You get up to around 3 or 4 or 5 pH in your stomach, okay, which doctors like, no, it needs to be down below 2. You get 3 or 4 or 5 approaching neutral, which is 7. Yeast and bacteria will grow in there, and every time you eat sugar or carbohydrates or fiber, they will ferment that into gas, and you get reflux. Not acid reflux, but lack of acid reflux. And so anybody who tells you to restrict salt, you should flee from them. Call the State Medical Association, State Licensing Board, and complain about them, because they cause what we call reflux or GERD, gastroesophageal reflux disease. It's all doctor-created stuff with misinformation, false medical theories. It never ends. That's why only Dead Doctors Don't Lie. This book and CD and DVD were so popular, yet today there's still biggest selling books and CDs and DVDs. Don't forget, the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and Password Aromatherapy, and learn how to deal with it. I mean, you can't absorb B12 because your intrinsic factor won't work if your stomach is not acid. Your pepsin won't work to digest proteins down to amino acids, and you're going to start absorbing polypeptides if you don't digest them without stomach acid. Guess what? You get allergies, food allergies, all caused by doctors giving you misinformation. Thank you so much, Doug. Super one there. We'll be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. The antioxidants found in many fruits and vegetables are known to help support and promote good health. Research has also shown that dark chocolate, once known as the food of the gods, is rich in healthy nutrients. In fact, dark chocolate is higher in antioxidant content than any other food. Youngevity has combined a proprietary blend of velvety rich dark chocolate with whole fruit pulp and whole fruit juice extracts from mangosteen, goji or wolfberry, acai berry, and cherry, along with vitamins and minerals, producing a smooth, rich, delectable concentrate called Cocogevity. It tastes so great, I sometimes drink it right out of the bottle or pour it over ice cream. Cocogevity is highly bioavailable, meaning your body will absorb and make use of all of these healthy nutrients. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you want to live to be well beyond 100 chronologically, say 110, 120, 130, 140, 150, 160, 170, 180, 190, 200 plus, while being chronologically 200 plus, while being biologically 30, 40, 50. Contact your Youngevity associate and ask for the books Epigenetics, The Death of the Genetic Theory of Disease Transmission. Get a hold of the book Immortality. Okay, Immortality goes into the top 20 longevity cultures and all their secrets, why they have 40 times 100 rules we do. And then get a hold of the book Rare Earth Bin Cures and learn all the diseases that are caused by mineral deficiencies. Remember, minerals are the currency of life. That's Epigenetics, Immortality, Rare Earth Bin Cures. Get on the 90 for Life, appropriate for your body weight. Get rid of the bad foods, fried foods, processed meats, oils, and glutens, and add a minimum of 25 to 50 healthy years to your life. equally important, add the 25 to 50 healthy years to your life of your kids. Okay, Doug, let's go to callers.
All right, let's head to New York. And Veronica, you're on with Dr. Wallach.
Hello, Veronica. You're on the air.
Dr. Wallach. Good afternoon, Dr. Wallach. So I'm so happy to get you.
Well, thank you. How can we help you today?
Well, let me do it fast and do it slowly. I have been struggling with nerve pain for the past 5 years. I've had a surgery from my neck, go straight down, and I was told I have fluid in my spine, and when they went down, there was nothing they could do.
Okay, now stop there. Okay, wait a minute. Whoa. You say you have pain. Do you have pain in your hips and down your legs into your feet, or is it up in your neck? Where's the pain?
The pain is just right in my rib cage underneath my right breast.
Okay. And they said that you have something going on there. Did they say you had bone spurs or degenerative disc disease or anything like that?
No, what they said is I have fluid was in my spine, and they could not take the fluid out. And they continue until...
How old are you, Veronica? How old are you?
62.
Okay. And how much do you weigh?
I weigh 212.
212?
Yes, and I just lost 29 pounds, so I was way up.
Okay, and how tall are you?
5'7.5".
Okay, 5'7.5". I'd like to see you weigh maybe 160. So you need to lose about 50 to somewhere between 50 and 60 pounds. Okay. So, do you have any other issues? Any diabetes or high blood pressure?
Thank God, nothing else but this burning. It just burns. I'm on fire. It just burns and burns.
On your
and
spine.
Like something is walking in my side. Yes.
Okay, I got you. Okay. Well, let's see. Miss Shar, are you there?
Sure.
Charmaine, are you there?
Yes, I'm here.
Okay, I couldn't hear you.
Sorry.
Okay. So, anyway. Okay, here's our friend Veronica. She's 5'7". She's 60 pounds overweight. She weighs 212. Mm-hmm. And she has She has what I would call peripheral neuropathy. The doctors looked at her. They said she has fluid in her spine. She's got more than fluid in her spine. 62 years of age. One other thing here, Veronica, were you taller when you were 20 years old? Were you taller than 5'7", or has that always been your height?
I think it's always been my height,
Okay. All right. Charmaine, she doesn't have any other issues she really wants to complain about? No high blood pressure, nothing like that? So think about it. When we come back, what kind of diet did you want to have her on, and what supplement program would you put her on to support healthy weight loss and to support healthy maintenance repair of her musculoskeletal system so we get rid of this peripheral neuropathy? Okay, we'll be back with Dead Doctors Don't Lie and Char's answers after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us toll-free, 888-379-2552. On the priority line, 831-685-1080. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.
This is the ZBS Radio Network.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you need to lose that 10, 25, 50, 75, 100 pounds or more, contact your Longevity associate and ask for the books Epigenetics, The Death of the Genetic Theory of Disease Transmission. The book Hell's Kitchen, the subtitle is The Cause, Prevention, and Cure of Obesity. And the book Energy Crisis, which goes into the keto diet, why you need the ketone diet to help you lose that half pound, 2 pounds a day. And then you throw in the healthy weight loss pack, 1 per 100 pounds of body weight. You'll lose a half a pound to 2 pounds a day. And the magic is you'll never gain the weight back as long as you stay on your 90. It's not 90 until you feel better. It's 90 for life, because the nutrients that are necessary to prevent and reverse obesity are no longer found in your food. You must supplement. Exercise alone won't do it. Remember, epigenetics, the book Hell's Kitchen, The Death of the Genetic Theory of Disease Transmission, Epigenetics, the book's Hell's Kitchen, the Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome, and then the book Energy Crisis to learn about the keto diet. Don't forget, we have the keto caramel shake and the keto caramel bars. Make it easy. You don't have to make stuff up and cook and run all over the store looking for stuff. We provide it for you all pre-mixed and pre-made. How easy is that? Okay, Doug, let's go right back to New York and Veronica. Okay, Charmaine, what kind of diet would you put this young lady on?
I would put her on a gluten-free diet, and of course, no oils, burnt animal fat, any of that stuff.
Well, how much gluten-free bread would you have her eat?
None, because there's sugar in gluten-free stuff.
Yes, because bread even if it's gluten-free, turns into sugar immediately. Okay, because it's processed grains. Okay, very, very good. Get rid of all that inflammatory stuff. And then what would you give her for a program to support healthy weight loss and maintenance of her physiology?
Well, I would give her 2 healthy bone-in joint packs, and then I would give her the Rev for the weight loss.
Okay, and what would you give her topically to put on her neck and her back to relieve the inflammation and pain?
Okay, the healthy bone-in joint pack comes with the CM cream, and she could add the trauma oil to it, and that is very effective for pain.
Okay. Now, what would you add to those 2 healthy bone and joint packs? Let's see here. I guess it's got the glucogel in it, right? So how many glucogel would you have her take every day?
Oh, I'd start out with 15 a day.
Oh, yeah, minimum of 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And there's one other piece we need to throw in to guarantee that she's going to optimally use that calcium. And I don't think 62 years of age, Veronica is going to get in a bikini and get out and lay in the sun for 6 hours a day. What would you give her?
I would give her the vitamin D3.
Yeah, absolutely. You get an A+ tier. That would be vitamin D3. I'd have her take 3 of those twice a day. It would be 2 bottles a month. And that's going to support and promote this whole program. The diet and the supplements are going to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself, and, of course, through the CM cream and the trauma oil, we're going to help her relieve the pain and numbness and burning, which goes along with peripheral neuropathies. We do not want any opioids or any of those kind of prescription painkillers. No, no, no. And then, if you would, please, Veronica, call us every 2 weeks. In New York, you can start the diet immediately. It might, depending on where they ship from, it might be anywhere from 3 days to 5 working days to get the products. But start the diet immediately when you hang up. Clean your house out of all the bad stuff. In fact, it wouldn't hurt. Send all the gluten products, the wheat, barley, rye, and oats. Send them to your doctor. Say, here, enjoy yourself. And then give us a call every 2 weeks. We'll walk you through this. And you're going to be a great, great testimony for our listeners. So we really appreciate you. Okay, Doug, we have time to start another one? Well, that answers that question. So hang on, everybody. Char and I are going to be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it, too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 95 Crusade. We do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're going to really be prepared for disasters, I mean, we're talking about floods and wildfires and earthquakes and hurricanes and tornadoes, it's just endless. And just think of all the hacking going on around the world now, and the grids go down, no utilities and all this stuff, no food, every delivery is messed up. So you want to have at least 90 days worth of the 90 essential nutrients for each person in the household, including the dog. Don't forget, tails are us, right, for the pets, and the cat and the dog and the bird and the fish. And then of course, you want to get a hold of the book, Prepare. The subtitle is The Prepper's Survival Bible. And you want to get a hold of the colloidal silver, our colloidal silver, Envision colloidal silver. You want to get our Pure Works. You want to get our Go Foods, which have 25 years self-storage, right? Complete meals. You want to get a hold of the Quanta water drops and our new filter bottle, so you can actually put like ditch water in there and filter it through the filter in the neck of the bottle to drink clean water. And then, of course, we need things like Killer Biotic. We need our aromatherapy oils. We need the good herbs, plant medicines. You need to get a hold of that trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport Aromatherapy, because you might have to be your own doctor for weeks or months or years, right? Which is safe. Okay, Doug, let's go to callers.
All right, let's head to Tennessee. And Miriam, you're on with Dr. Wallach.
Hello, Miriam, you're on the air.
Thank you. I'm calling for a friend in his 40s who weighs about 190 pounds. 25 years ago, he was diagnosed with idiopathic AFib, for which he has been taking blood thinners. And 5 years ago, he was diagnosed with multiple myeloma. After beginning chemotherapy, he developed peripheral neuropathy. He now has thrombocytopenia, anemia, and plasmacytosis. He's currently no longer on chemo. His platelet count dropped to 1,200, and last month he was diagnosed with plasma cell leukemia. 2 weeks ago, he began bleeding
plasma cell what?
Leukemia.
Leukemia.
Yes.
Okay.
2 weeks.
Well, plasma cells, of course.
2 weeks ago, he began bleeding from his gums, and 1 week ago, he began bleeding from his GI tract. He's no longer taking blood thinners. His diet's currently limited to applesauce.
Yeah, I'd get him off of blood thinners if he's bleeding out of his GI tract. Okay. Jeez.
Yeah, he's off of that.
Okay. Now, let's stop there. I mean, you've got 10 million things going on around here already, so let's stop there. Everything else is going to be related to this. AFib. Shar, is AFib a heart problem?
Absolutely not.
What causes AFib?
It's a mechanical problem where the nerve that controls your heartbeat is being squeezed because of the cartilage being...
Degenerative disc disease, yeah.
Yeah, gone.
Okay, very good. Now, that goes along with a lot of what he has here. Now, I'm always suspicious of a diagnosis of multiple myeloma, which is a cancer of the cells inside the bone marrow. Thrombocytopenia means he has low platelets, right? And that goes along with the bleeding stuff, all right? And now he's got some kind of leukemia and all this surrounding his bone marrow. And I've dealt with so many people. Remember, I'm a pathologist. And there's a disease called myelosclerosis. It's also the same disease also called myelofibrosis. We have osteoporosis, which this guy has, osteoporosis. And the bone marrow cavity is filling up with scar tissue, which is very primitive cells, okay, from a fibroblast. They just don't look like anything except scrapings off of a tendon, very, very simple fibroblast. And they're filling up the bone marrow cavity and squeezing out the cells that make red blood cells, so sometimes they can be anemic. They squeeze out the cells that make platelets, so they get thrombocytopenia or low platelets, so they get bleeding all over the place. They look like they're on blood thinners even if they're not. And doctors like to treat them for multiple myeloma, okay, because it's $40,000 a treatment. But it's really, I don't know what the percentage is, very high, 75, 80, 90% of the time when you get diagnosed with multiple myeloma, you want to go get another diagnosis, take the same data. Don't even have to get all the tests again and bone biopsies again. What you do is you have everything sent to the university department of pathology. Say, hey, we want you to look at this stuff. We want you to see, is this multiple myeloma? Is this is this myelosclerosis? Is this myelofibrosis? We want to know your opinion on what all this is before we decide on what treatment we're going to do here, okay? So this guy weighs 190 pounds, so he may or may not have leukemia. He may or may not have multiple myeloma, and he may or may not have myelofibrosis. But until I get a second opinion that says he's got multiple myeloma, which is the cancer, I'd kind of go for the, for the multiple sclerosis or multiple myelofibrosis, which is a long-term osteoporosis thing. But we'll kind of approach it for both considerations. But in the meantime, he needs to get a second opinion. I prefer the medical school pathology department because they have no axe to grind. They get paid the same no matter what the diagnosis is. It's not like they're making a diagnosis to get themselves paid more, right? So, Charmaine, what would you do for this 190-pound guy to help him with his various problems?
Well, for all the problems, I would get him on 2 healthy brain and heart packs, but I'd also add the glucogel to that.
Okay, yeah, I agree.
And I would also add the what do you call it? The Ultimate Daily Classic and the BTT 2.0 tablets in case he does have something.
Okay, sure. And what liquid would you give him to support his immune system? It has some super juices in it, and
I give him the Z Radical.
Z Radical, yeah, exactly. Okay, so here's where we're going to go here, Miriam. Char's exactly right. Got to get him off of all the inflammatory things. No fried foods, no processed meats with nitrates and nitrites, no oils, no glutens, no wheat, butter, and oats. But we'd also like him to have, and this is again to support his body's want to repair itself. This is going to support his immune system. Okay? 2 healthy brain and heart packs, as Char said. That's exactly right. A full dose of everything twice a day. I'd have him get the glucogel, 2 large bottles of glucogel, 240 count, to support maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, because it's degenerative disc disease, and the vertebrae getting close together in the upper back, T1, 2, 3, and 4, thoracic vertebrae 1, 2, 3, and 4. Those discs are getting thinner, the vertebrae getting closer together, smashing the roots of the spinal nerves that control the rate and rhythm of the heart. Then I would, Char's exactly right, to deal with blood flow and all that kind of stuff, the Ultimate Daily Classic tablets, I'd go ahead and give me 3 of those twice a day. That's 2 bottles a month. And let's see here. What else did you say, Char?
I said the Z Radical and also the BTT 2.0 tablets.
Yeah, okay, very good. The BTT 2.0 tablets get the antioxidant points up there to support the immune system. I'd go ahead, until you know better, I'd go ahead with 2 of those twice a day, 2 at breakfast, 2 at dinner time. That's 1 bottle a month. That'll get his ORAC points, his antioxidant points, up to 160,000 a day. And then also the Z Radical. I love that for people who have malignancies because it supports their immune system. There's like 850 university studies on this in Japan, and because they attribute their low rate of cancer and their high survival rate from cancer to this substance they get from red marine algae, okay? And it's called fucoidan. And I just love the Z Radical, Z like zebra dash radical. He needs 2 quarts a month so he can take an ounce at breakfast and dinner. It has 3 super juices in it, again, support the immune system, plus this fucoidan. And it's a great way to really, really, really support the immune system. Also, he's going to be getting everything necessary to support maintenance repair of that bone marrow, all right? And so give us a call when you get the second diagnosis, the second opinion. And again, I would prefer the second opinion come from the University Pathology Department, Medical Department. And he doesn't have to redo all those tests and bone marrow biopsies. They can send the slides of all those tests and the results of all those tests to the university, and they can use the same material so he doesn't have to suffer anymore. And then call us every couple of weeks, and we'll walk you guys through this. And hang on, everybody. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. Imagine a rich, decadent chocolate that's actually good for you. Longevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Hello, Judy DeVilbus here. If I could only afford to get one product out of everything, that product would be the Ultimate Classic. It has the vitamins, the minerals, the bioflavonoids. It even has grapeseed extract. The one product that would give you just about everything under the sun you would need for a perfect nutritional program would be the Ultimate Classic. By the way, people that are on the go, it's very, very hard to take the liquids with them when they go on their trip to get their supplements in every day. Well, you know something? You can use the Ultimate Daily tablets and the mineral capsules. When I'm going on a trip, if I have enough room, I just take the 2 bottles with me. If not, just use a little baggie and take a couple of daily doses with you. It's very simple. It's very easy. There's no mess, no fuss, no refrigeration. Just take your capsules, take your tablets, and you're finished for the day.
To order these products, call your local longevity distributor today. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Texas. And Russ, you're on with Dr. Wallach.
I'm sorry, didn't get the name?
Russ.
Russ. Okay, Russ, you're on the air.
All right. I have a friend who has a 5-year-old girl who complained of headaches and black and white vision. Turns out she has a brain tumor that's inoperable due to blood vessels and nerves.
Okay, how much does she weigh, you think?
I haven't met the girl. I don't know. She's a 5-year-old.
Okay. Well, a 5-year-old, let's say, is anywhere between 25 and 40 pounds. Okay, let's say somewhere in there. And, of course, you have a brain tumor. It could be benign. It could be malignant, right? I don't know any more information than that.
Yeah,
and,
they just said that she's having headaches and blur and black and white vision.
Mm-hmm. Okay. So the location is probably somewhere around the optic nerves, the optic sort of part of the eye that deals with that, all right, in the brain. So at any rate, let's see here. Number one, I was going to say just on a diet, I'd make sure she gets rid of all the inflammatory stuff. No fried foods, no processed meats, no oils, no glutens. All that's got to go. And then wouldn't hurt for them to get the CD called Serial Killers, goes into all the hidden platents to find gluten. She needs to start eating eggs, soft scrambled butter. And then I would give her, let's say she weighs 50 pounds. Well, even if she weighs 38 to 50 pounds, I'd give her one Healthy Brain and Heart pack, and that's going to last her 2 months. That'll last her 2 months, half a dose a day, and half that, so she's getting a quarter of a dose of breakfast, quarter dose at dinner time. So you make up an adult dose, and, you would take a half of that dose today, give it to her, divide it up, half breakfast, half dinner, the other half from the refrigerator, shake it up real good, and then divide that up again, give her that tomorrow kind of thing, okay? And also, I'd give her some auric points. Char, what would you give this 5-year-old that tastes good, give her some high auric points?
The chocolate, the Triple Treat chocolate.
Yeah, Triple Treat chocolate. Each one of those has about 17,000 auric points each. She could take, start out with 2 a day. They're the size of a pat of butter. Dark chocolate sweetened with sugar. No, sweetened with blueberries. And so She could have one of those at breakfast, one at dinner time. She can also have 2 teaspoons, which is about a third of an ounce, of the Z radical, okay, at breakfast, and 2 teaspoons at dinner time. Again, that's going to raise her auric points and get that fucoidan into her. And then let's have more information. Call us back. Let's start there. Okay, Doug, let's go to callers.
Well, let's head to Bridgeport, Connecticut. And Bob, you're on with Dr. Wallach.
Hello, Bob. You're on the air.
Wallach. So glad to be here.
How can we help you?
My situation, I have type 2 diabetes, arthritis, and a little bit of high blood pressure.
Is this your...
I have been on the packs, but I wasn't faithful on it all the time.
Okay. We only have a few moments here. How much do you weigh, Bob?
Okay, I weigh now 226.
226? And how tall are you?
5'7".
Yeah, 5'7". Yeah, 5'7". I'd like to see you, weigh 160. So 40. You're 66 to 70 pounds overweight here. Okay, Charmaine, we only got minutes. What would you give him? He's got type 2 diabetes. He's got high blood pressure, arthritis, and he's overweight.
Well, I would, to support all those issues, I would get him 2 healthy brain and heart packs, and I would add the Sweeties, and I would add the Daily Classic, Ultimate Daily Classic.
Okay, very good. And then what would you give to support healthy weight loss?
I give him the Rev.
Rev, okay. So, as Shar says, get rid of all the bad stuff, no fried foods, no processed meats, no oils or glutens. You want to get 2 healthy brain and heart packs, a full dose of everything twice a day. Get a hold of 2 bottles of the glucogel, the large 240 count. You can take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. Go ahead and get 2 of the bottles of Sweeties. So you could take 3 of those twice a day. Get a bottle of glucogenics. You can take 2 or 3 of those at lunch. And take your fasting blood sugar every morning before you medicate yourself. Reduce your medication as your doctor has taught you to do as your blood sugar drops. High blood pressure, as Shar says, you're going to take the Ultimate Daily Classic tablets. I'd go ahead with 3 of those twice a day. That's 2 bottles a month. They're going to support healthy blood flow through blocked arteries and support healthy blood sugar and also healthy blood pressure. And then, of course, the Rev, as Shar says, get 2 of those bottles and take a dropper full 30 minutes for each meal under your tongue. Leave it absorb through your oral tissues. Take a second dropper full under your tongue 15 minutes for each meal and let it absorb through your oral tissues. And you'll begin to lose a half a pound to 2 pounds a day. And call us in 2 weeks and 4 weeks and 6 weeks. We want to know your blood pressure. We want to know your diabetes numbers, your blood sugar numbers. We want to know your weight, and we'll walk you through this. Well, thank you, everybody. Great questions and testimonies today. Thank you so much, Shar. Super job as usual. Thank you so much, Doug and Sam. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless America.